So I'm ready to go. So greetings from the National Health Service in England. So ready to go, my first slide? Okay. So, my hope is for a world where we can mobilise and call to action all the tremendous resources that we have for change, people that use services, families, our workforce, bigger communities, so that collectively we can create the kind of future that we want. I want to illustrate this by talking particularly this evening about dementia and the plight of thousands of people with dementia in England who are fed antipsychotic drugs inappropriately. Every country I go to, this is an issue, and I've got no reason to believe that this isn't an issue in Canada as well. Dementia is a progressive terminal disease which affects language, it affects judgment, and it affects memory. Got two scans here. The first scan is somebody with normal brain activity, lots of red and yellow, lots of brain activity. The second is somebody with dementia, lots of blue space, lots of black, brain cells are dying. You know, dementia is something that we should all be concerned about. Actually, I would say it is the health and social care challenge of the 21st century. In England, we have 750,000 people with dementia. In 40 years, that will double. It costs us in the UK £23 billion a year. The reason why I call it a crisis is when we look at the expected rise in dementia cases. This is a complicated graph, but it shows between 2005 and 2051 what's going to happen. For people aged under 85, there is a small rise in the incidence of dementia. For people over 85, there is a massive increase. And the reason why is because dementia is basically a disease of old age. So what this graph tells us is that if you're 70 years old, you've got a 1 in 100 chance of developing dementia. Okay? If you're over 90 years old, you've got as much chance nearly as developing it as not developing it. With dementia, come profound behavioural and psychological symptoms. These impact on about 90% of people with dementia. They are distressing and they're problematic for carers. Too often, we treat people with these symptoms with powerful antipsychotic drugs, drugs that are intended for people with schizophrenia, frail, distressed, older people. We should only use these drugs sparingly for a short period of time in the most severe of circumstances. The reality in Britain is that we give them to thousands of old people with dementia to keep them quiet. So out of about 750,000 people in England who have got dementia, about a quarter of them, are given antipsychotics, and most of it is inappropriate. Every year, about 1,800 people die as a result of these drugs. About 1,600 have a stroke, but the worst thing of all is what it does to rob people of their quality of life. A big issue around people with dementia is hospital admission. Because what happens, people get admitted to hospital with dementia. If you can imagine a situation where it was more distressing or frightening for somebody with dementia, very often people with dementia are appropriately given these drugs when they're in an emergency medical admission, but we then keep them on them for the rest of their lives. But it really doesn't have to be that way, because through the work that I've been doing, I've got to see a lot of people with dementia who have a fantastic quality of life. And dementia doesn't have to be a kind of bleak, lonely pathway to death. And, I've got through my work, to go to lots of care homes and to memory cafes, and what you see there is amazing. People with dementia and their carers eating the food of their youth, listening to the music of their youth, playing the board games of their youth. And these are places of joy and calm and hope. And it's about valuing who the person is, beyond the dementia. And it's a very humbling thing. So in June last year, my organisation, which is called the NHS Institute for Innovation and Improvement, we joined forces with a phenomenal social movement called the Dementia Action Alliance, which is about 80 organisations across England who want to improve the plight of people with dementia. And our goal is that by the end of this month, okay, from 9 months from when we started, that all 180,000 people with dementia would have a clinical review. So, do people need to be on these drugs? What alternative treatment? And how we've done this, okay, is that we've called people to action. We've said, who are the people that we need to take action to kind of put this terrible situation right? And we've called to action people with dementia and their carers, the voluntary and advocacy organisations that support them, the clinical prescribers, the GPs, the psychiatrists, the hospital doctors, and also those in authorities. We've signed up people that lead care homes, all the major pharmacy chains and so on. And each group has made a commitment. So this is an example here of the commitment that was made by the pharmacists. And they're basically saying, we will review all the people on our pharmacy register and get things changed. And a particular group I wanted to tell you about are the hospital pharmacists, because again, talking about that awful situation of people in hospital with dementia who go on antipsychotic drugs and stay on them forever. And what our hospital pharmacists are our secret weapon, because what they're doing is they're managing that transfer really well. This is me with my Auntie Joyce, and she's my godmother, and she died 5 years ago. And for the last 6 years of her life, she was in a care home with dementia, and she was sedated with antipsychotics the whole time. And she basically spent that entire time, sitting on a chair, withdrawn, subdued. And, at the time, I thought, it was like a part of, her illness, the kind of tragic consequences. And now I know it doesn't have to be that way, and I'm angry as hell. So my hope for the future, okay, is no more Auntie Joyces sitting there subdued, because we know that people who have dementia can have a fantastic quality of life, and it's up to all of us to play our part in making this happen, and I hope you'll join me.